Hello, good afternoon. I'm going to introduce this presentation on behalf of LALDI, Spanish patient organization about LALDI. First of all, I would like to introduce by myself. My name is Eduardo Lopez. I am 54 years old. I'm working in Fujifilm, Europe, since 1994 as a business director. And this is my wife. She is Sara Salinas. She is 49 years old, and she was working in the same company till Martina was born in July 2011. Martina is the real reason because I am here. She is the reason because I am defending the rare disease worldwide. She is suffering LALDI, and I'm going to explain you later what is LALDI. But she is the real reason for my engagement with the rare disease. First of all, I would like to explain what is about rare disease, because today is the Global Rare Disease Day, and I would like to explain you the challenge to live with rare disease. First of all, we should think that rare diseases are really very strange disease in the world. Only 5 people over 10,000 people are affected by this type of rare disease. We have 7,000 rare diseases in the world. 80% of them are genetic, and around 3 and 4% of the newborns are affected by rare disease, and all of them are chronic, degenerative, living treatment, and the majority of them are suffering in the childhood. The quality of the life is sometimes compromised, and this type of disease impact in the patients with a big impact about psychosocial environment. The majority of them are incurable with any type of treatment, and sometimes the families are trying to look for the right treatment and the diagnosis, but it's really very difficult to find out. In Europe, we have 30 million of people affected by a rare disease, and 3 million in Spain. All of them are really difficult from the beginning. First of all, because it's not easy to find out the diagnosis. Secondly, because you cannot find expert clinics or physicians that they know the rare disease, or they cannot know all of them, because it's really very difficult to know 7,000 diseases in the world. And finally, it's really very difficult to access to the treatment if this treatment exists. But at the same time, as I mentioned before, this type of rare disease has an important psychosocial problems around the patients. These type of diseases are not social visible. You have a lot of problems at the school. If you are suffering a rare disease, you have anxiety, and also your familiars, and always the caregivers has a extra workload. Nobody can understand what is happening. It's really unstable. Isolation is a big impact under the psychological point of view, this type of disease. And what about LALDI? What is LALDI? LALDI is an ultra rare disease. I'm going to explain a little about this disease. What is the lysosomal acid lipase? The lysosomal acid lipase is an enzyme encoded in the LIPA gene. This is fundamental for the life, because this type of enzyme encode all of cholesterol, esters, and triglycerides for all of people. But a mutation in this gene immediately causes the loss of the functionality, and immediately you are going to suffer a lot of different clinical manifestations. Here you can see an example. I am a physician, but this is the flow with a healthy individual, and this is the flow for the patient affected by LALDI. You can see here the LAL enzyme, and you can see here no LAL enzyme. Immediately in a healthy individual, if you have the LAL enzyme functionality okay, you are going to elaborate the cholesterol esters. But it's not the case of the LALDI patients. Immediately, as you can see here, you are going to have high cholesterol in your blood, and this cholesterol is coming back to the blood and affecting a lot of organs in your body. you have the deficiency of the of the lysosomal acid lipase. In this case, as I mentioned, is a genetic problem in the LIPA gene. The prevalence of this disease, nobody knows. As you can see here, is really difficult to know the prevalence of this disease, but is an autosomal recessive transmission partner. That means that if you are a couple, you will have the possibility to have only one child affected by LALDI. If you have 4, that means you have 25% of the possibilities to have this type of affected children. And immediately you are going to suffer a damage in the liver, intestine, and also in other organs, as you can see in the next slide. Here you can see the prevalence. You can see different works published by clinicals and researchers, but as I mentioned before, nobody knows the real LALDI prevalence in the world. And as I mentioned before, the clinical manifestations are related to the liver, to the spleen, cardiovascular system, and also the digestive tract. And here is an example of what is happening. If you have the LIPA mutation, you don't have enough LAL enzyme in your body, and you are going to suffer a lot of different manifestation in your liver, in your heart, in your spleen, and also in your intestine. And here you can see the different clinical consequences. You have different phenotypes and you have different symptoms. If you are a baby with no LAL activity, you are going to suffer slow growth, persistent vomiting, and diarrhea, and the majority of them, they are going to die before 4 years old. What about children? In this case, is different. They can survive because they have a residual LALDI activity. They are going to suffer fibrosis and cirrhosis of the liver, and immediately they are going to have accelerated arteriosclerosis. And what about adults? In this case, they are going to survive again, like children, but they have residual LALDI activity, they have liver disease progression, and they are going to have cardiovascular events when they are really very young people, around 20, 25 years old. What is the situation? With this type of symptoms, all of physicians can look for different diseases, not only rare diseases. Immediately, the physician can think that these people or this patient is going to suffer familial hypercholesterolemia, Wilson disease, or other type of metabolic syndromes, or non-alcoholic fat liver disease. But you have only one way to detect if the patient is suffering LALDI, the dry blood test. With this easy test, you can find if you are having a deficiency of the LAL enzyme. And immediately the second step is to look for the sequence of the LIPA gene and look for the fail of the gene in your body, as you can see here. Immediately the diagnosis is confirmed. Here the situation in Spain, we have 40 cases, only 40 cases, because it's an ultra rare disease. And Spain is the second country in the world. You can see the number of people by territories. And here you can see the people by age. We have 3 babies, we have 19 pediatric patients, and we have 21 teenagers and adults. What about our association? Who is LALDI? We found the association in January 2015, looking for the main goals: take care of patients and families affected by LALDI, support patients in order to receive the treatment, because we have a treatment, spread out information about LALDI in our society, improving diagnosis, and promote research around LALDI. Today, you can see the families in Spain. We have different families meetings, each by year. We have different conferences in the country, talking in different scenarios and participating in different events. We are also participating in an official ad. You can see here our Queen and the Prime Minister. and we are trying to spreading up information about LALDI. But our main big milestone was to participate in the process of the drug approval. Kanuma is the name of the treatment that we have. You have here this type of treatment is called, the general name is Servelipaz alpha. This treatment was approved by the European Medicine Agency in September 2015, and finally by the Spanish government in January 2017. And thanks to the participation in the activity of the patient organization, we got it. You can see here the document that we wrote to the Spanish government in order to get the treatment. This is the orphan treatment. That means only one type of drug for this type of disease. No way. This is the only solution that we have. But this treatment is not curing the people. This treatment is only a step to sustain the life of the people. And here you can see the consequence of the treatment is treatment that you can receive each 2 weeks in the hospital. And this is the last report about the treatment. And the treatment is effective, but still is too early to consider this treatment safe. Why we are doing this? It's easy to understand. We are a proactive patient organization. We are the second country in the world with a number of LALDI cases, and we have engaged physicians and researchers. We are trying to work together, and we have created a Spanish LALDI expert group in order to look for more information and try to research about this disease. You can see some examples of this LALDI expert group with different physicians and researchers and different meetings that we have done in Spain. You can see here the cities and the dates of these different meetings. And finally, today, 6 years later, we are working in different research projects. One of them is related to the dyslipemia patient register, including LALDI patients across Europe, in order to increase the knowledge about the evolution of the disease. We are trying to find out fibrosis by biomarkers in order to avoid biopsies. We are improving our elastography magnetic resonance in order to avoid these liver biopsies too. We are trying to improve the blood analysis test algorithms in main hospitals in Spain. Now we are introducing the artificial intelligence to facilitate early diagnosis through a company called VDCare. And finally, we have two points more. One of them is we are studying how the LALDI affected the bones. And finally, we are working with Dr. Martin in US in order to develop the gene therapy, because the gene therapy is the only way that we have to cure these patients. We don't have any other possibility. This is the current relationship that we have with different patient organizations, as you can see here in Spain, but also in Europe. But we have more relationships with other patient organizations in Spain and also with the Spanish government and the European government. And that's all for my part. Thank you very much for your time.